Ian Temperton, Team Manager for Norfolk County Council's road safety function. We do try and prevent crashes. We spend a huge amount of time and money making sure it doesn't happen, but they're down to human error. We make mistakes. We know that when those mistakes happen, every minute that can be saved at the side of the road will save hours in rehabilitation time later. It saves a huge amount of money for the medical profession. And of course, it improves the chances of surviving a crash or reducing those injuries, which is why an organisation like the Norfolk Accident Rescue Service is invaluable.
So Chris, tell me about Norfolk Accident Rescue Service.
Okay, the Norfolk Accident Rescue Service is now 40 years since establishment. It's a charitable organisation that once when it started involved general practitioners who respond from their surgery or at home to assist the ambulance service in managing critically ill patients, particularly from road traffic accidents. Over the years we've had to develop with advances in medical technology, etc. So it's important now that we provide a higher level of care. So what we do is we involve doctors and paramedics that respond from home in their own time. Once again, still responding in their car and just providing that little bit extra care that paramedics require for these types of patients.
Just give me some idea of the sort of incidents that you get called to.
Okay, the critical care desk will send us to road traffic collisions more commonly. Because of our extra skills in managing those types of patients, we can provide good pain relief to those patients. Often cardiac arrests, both medical and trauma, and quite often ambulance crews themselves will call us up for particularly difficult, complex cases. So it's a mixture, but generally the high-end type of incidents we get called to.
Hello mate, you alright? Can you hear me? I better go and get some help. Hello mate. Hello, can you hear me? He's gone into cardiac arrest. Yes please. Paula, can you get an ambulance en route? We've got a male, approximately 40 years of old, coming with suspected cardiac.
Sierra 01 Control. Yeah, can you call 999 please? Suspected cardiac arrest, approximately 60 years of age.
Yeah, I can confirm he's unconscious and not breathing, not breathing, not breathing, not breathing.
I'm an anaesthetic registrar currently working at Adam Brooks Hospital in Cambridge. I live in Norwich and I'm one of the basics doctors working out of Norwich. My primary role is to help crews out on the road if required, either to provide backup as a crew request or from a primary dispatch. The idea of me being on scene is really to support ambulance crews with whether it's a medical or a trauma patient. I carry a number of additional drugs to support patients with sepsis, patients with infection or asthma, preeclampsia, a number of medical conditions, and provide the level 2 skill set from the trust with regards to trauma.
Okay, CF, back on the chest please.
compartment solution, 500 mils.
Yes.
Okay. Everyone clear, clear, clear. Good CO2 tracing, easy to ventilate.
Okay, yeah, we're giving fluids. We're giving a 500 ml fluid bolus.
What's amiodarone?
So 300 milligrams amiodarone. Clear.
There is a pulse with that. That is quite slow.
That's absolutely fine.
And temperature probe, that's in there. What's our temperature?
Temperature probe.
Blood pressure's coming. Okay. I'll get a second line in as well. Bob, you right?
Okay, BP cuff on.
Okay, I'm just going to get another line in, guys.
Flush when you're ready.
Thanks. You check that expiry now?
7/2015.
Yeah, roger.
Clear for a second, guys.
I'll give it some cold fluids.
Okay.
Okay. And happy with the tube?
Yeah, happy with the tube. So he's breathing about 6 a minute, but still tolerating the tube. So we're just going to carry on as we are.
Okay. Right.
We've got a good output now. CO2's come up to a good level. I think we're ready to go as soon as the trolley and scoop are in place.
Yeah, we're at Ross, got good odds, so we're going to run to the NNN. We're pre-alerted, they're waiting for us. Good. Have an anaesthetic team there.
Yeah, that
Happy?
sounds good.
Chris, tell me about the Cars for NARS campaign.
At the moment, the NARS responders respond from home in their own car with blue lights on, which is an essential part of the service we need to keep, particularly in major incidents. What we'd like to do is have a rapid response car, much like the ambulance service rapid response vehicles, where we can provide more cover really. So responders will provide more shift work for us, and that makes us better for response times, and just makes us more available for hours we don't normally cover.
Yeah. And you just stick a blue light on top at the minute, do you?
Yeah, we do. We literally that. We just have a blue light we put on. Obviously, all our members have advanced driving, but essentially having a rapid response unit just gives us more road presence as well. And it's another way of training new members, which is an important thing.
This is a very ambitious project. To deliver the service level we require, we are looking at around £100,000 to buy vehicle, fully equip it with the specialist equipment, the monitoring, the major incident equipment, the full protective clothing that we will require for our members. Having a dedicated response vehicle will allow us to mobilise quicker, get to scene quicker, which will ultimately bring the expertise and the additional equipment to benefit of the patient, improving patient outcome and rehabilitation. People can get involved and help NARS in a number of ways. They can donate money, they can do fundraising events for us, and businesses could also sponsor us. We urgently need people to help us to improve our service and to help us continue saving lives. To get in touch, go through the website nars.uk.com.
There are a lot of professionals involved in the casualty reduction world. Organisations like NARS will help at the point of crisis. When it goes badly wrong, when we're at the side of the road in desperate need of help, these people will be there to assist. They work with other professionals, they're fully trained, highly skilled, and frankly, we need them.